Good morning, and thank you for joining us today. I'm going to give everybody a moment while attendees continue hopping on, and then we will get started. Okay. Good afternoon, everyone, and welcome to the California Immunization Coalition Education Hour. All attendees will be in listen-only mode. If you need technical assistance, please use the chat box on the bottom right of your screen. A link has also been sent out in the chat box to all participants that can help troubleshoot any technical issues. During this webinar, you're welcome to ask questions, and you can do so by typing them into the question box or the chat box on the lower right of your screen. Questions will be answered at the end of the presentation. If we run out of time, we will answer remaining questions over email. Now introducing your host and moderator, Meg Dorsey.
Greetings, everyone, and welcome. We know how busy everyone is these days, and we're so grateful that you've chosen to spend your hour with us today. My name is Meg Dorsey. I'm a CIC board member and chairperson for the CIC Education Committee, and I'll be your moderator for today's call. The California Immunization Coalition hosts education hours throughout the year on immunization-related topics to help our colleagues stay up to date on important news and information. Today, we have a very exciting and timely program for you, which is titled Families Fighting Flu, More Important Than Ever. Following today's webinar, a recording of the webinar will be available on the CIC YouTube channel, which you can access at the immunizedca.org website. If you're unfamiliar with this new feature on the CIC website, I encourage you to check it out. And while we will hold questions until the end of the program, please feel free to enter them at any time during the program in the question or chat section on your screen. As our featured speaker today, we are so pleased to welcome Serese Marotta. Serese is the Chief Operating Officer for Families Fighting Flu, a national nonprofit organization dedicated to saving lives and reducing hospitalizations by protecting children and their families against influenza and via education and advocacy. Prior to joining Families Fighting Flu, Serese worked as an environmental scientist for 16 years at a consulting firm conducting ecological and human health risk assessments for hazardous waste sites. She now works tirelessly to raise awareness about the seriousness of flu and the critical importance of annual flu vaccinations for everyone 6 months of age and older. Her personal story, which you will hear in a short while, about how she became involved with Families Fighting Flu, along with her leadership, her expertise, and collaborative spirit, have made her a valued and effective public health advocate, and we're so grateful to have her with us today. Today's webinar will also feature 2 guest speakers from California Department of Public Health Immunization Branch, who will share the California perspective on the current flu season, and also share some excellent resources for all of us to use in our efforts this year. Nisha Gandhi is the Adult Immunization Coordinator with the Immunization Branch. Nisha oversees California flu vaccination program for local health departments and is involved with the Vaccines for Adult program. We will also hear from Anya Gutman. Anya is health educator at the California Department of Public Health Immunization Branch, focusing much of her efforts to promote adult immunizations through the Vaccines for Adult program as well. This year, she's also taking a lead role in flu vaccination campaign activities at CDPH. Our objectives for today's call are, at the end of today's call, we will meet these objectives. Detail the importance of annual flu vaccination, understand how personal stories can support efforts to achieve broad immunization coverage, and become familiar with many national and California-based resources to support efforts to fight flu. And now we welcome Serese Marotta to begin her presentation. Thank you again, Serese, and the mic is yours.
Hello, everyone. Hopefully you can hear me okay. Cameron, I don't see the slides. I'm sorry. Are those up? Oh, there we go. Okay. So welcome, everyone, and thank you for that very kind introduction, Meg. I'm very happy to be here today. I'm going to talk to you about a couple things, communicating the importance of flu vaccination, use of personal stories in that communication, social media, and other resources. Next. So first, we're going to do just a quick poll question. The question is, have you heard of families fighting flu previously? If you could all just go ahead and answer that, yes, no, maybe, and then Cameron will share the live results of that poll.
All right, we do have responses coming in. I will close the poll in about 10 seconds. Okay, and I'm going to close the poll now and share those results.
Okay, so we've got some people that have never heard of us, so that's great. So you're going to learn about us today, and about 30% of you are familiar with us, so that's fantastic too. So next slide, please. Okay, so this is our agenda. This is what I'm going to touch upon today. Number one, I'm going to talk about communication strategies, and these are strategies that we use here at the Families Fighting Flu organization, different channels, messaging, etc. Almost most importantly, I'm going to talk about, no pun intended, the importance of personal stories when we're communicating to folks about the importance of flu vaccination. And how important those personal stories are. And then I'm going to also briefly talk about available resources in terms of education. Next. So just to level set, let me give you a little bit of information about Families Fighting Flu. Our name is very appropriate in that it's more than just our name. It's who we are and it's what we do. We are made up of member families, families that have been personally affected by influenza, like myself. But beyond that, we have obviously a board of directors that help direct the organization's day-to-day activities. We have a panel of medical advisors, 12 of them, because I am not a healthcare professional. Kudos to all of you out there who are, but we certainly rely on our medical advisors to answer those really tough questions. And then we also have a panel of staff and volunteers, advocates from across the country who may not have been personally affected by influenza, but are passionate about flu awareness, prevention, treatment, etc. So really what we do as an organization at the end of the day is education and advocacy. This organization has been around for 16 years. It was originally formed in 2004. By families like mine that were affected personally by influenza. And these families got together, they had lost children to flu, and said, you know what, we really need to do something about this. Too many people aren't aware about the seriousness of influenza, and we need to work towards making that a reality. We need to share our stories, we need to educate, we need to advocate. So we have had a slew of different educational campaigns over the past 16 years. But again, at the end of the day, it really comes down to education and advocacy for us. And what we really do is we serve as an unbiased resource for people. We certainly are talking to the general public, almost in a peer-to-peer capacity, parent-to-parent, but we're also working with healthcare professionals, people in academia, folks in immunization coalitions, anybody out there who has anything to do with flu. We want to work with you guys because we know we can't, none of us in and of ourselves can do this job. It really takes all of us. So we really want to be that resource for people. Next. So I'm going to start with my story. And this is my son, Joseph. And I will start by saying in 2009, he was a healthy 5-year-old boy. He was attending kindergarten. He loved cars and puzzles, Transformers, Star Wars, the normal stuff that a 5-year-old was doing, he was doing. He was so excited to be in kindergarten. He was loving, he was joyful. He was his sister's best friend. He was really one of the lights of my life. Sadly, my son's story does not have a happy ending. I've always been pro-vaccination. Joseph was vaccinated against flu. This was October 2009. So if you recall, that was during the H1N1 pandemic. And the pandemic strain of H1N1 was not in the vaccine that year. So Joseph fell ill. He threw up on the school bus one day. It was all very innocent. And I think because he's our second child, we're like, okay, no big deal. We picked him up. We brought him home. He continued to get worse. Eventually went to urgent care, eventually ended up in the hospital. He was diagnosed with pneumonia, several days later diagnosed with influenza. And the whole time as a parent, you know, I'm thinking, okay, this is flu, this is pneumonia. We're in the ICU of a children's hospital. We are doing everything that we can. We're gonna get out of here. He was in the hospital a total of 10 days. And on the 9th day, his condition deteriorated quite quickly. And unfortunately, we lost him due to complications of H1N1 influenza. I will tell you that even though I was an environmental scientist, I was an educated person, I was what I would call a conservative parent, I had no idea how dangerous flu was. I remember standing in the the ICU with the doctor after watching them work on Joseph and try to revive him for 35 minutes. And I remember turning to her and she said, he is the 85th child to die from flu this year. And I looked at her and I said, what are you talking about? I had no idea how dangerous flu was. And about 6 months after my son passed away, you know, for our family, we very immediately knew we needed to do something about this. We needed to find out of other families. We needed to share with others what we didn't know. And that is exactly how dangerous flu can be, how important annual vaccination is, as well as other prevention strategies. So 6 months later, after Joseph passed away, I found Families Fighting Flu, and I became part of that organization very quickly and volunteered, shared my story, eventually sat on their board of directors. But the one common theme that we have here at Families Fighting Flu, as far as the families are concerned, is that we have all been personally affected, but at the end of the day, we want to prevent this from happening to other families. So this little boy, Joseph, is the reason I'm here today. It's the reason I spend each and every day fighting flu. Next slide, please. So we are going to do a quick another poll. So the question is, do you get an annual flu shot? Yes, no, or sometimes?
All right, thank you guys so much for answering the poll. We'll give it another 5 seconds or so, and then I will go ahead and close it. All right. And here we go.
84%, yay! For those of you that are no or sometimes, hopefully by the end of this presentation, we'll give you some additional information to consider and hopefully get you moving in what we hope to be the right direction. So next slide, please, Cameron. So I really want to frame the problem. And I think this graphic of this woman kind of holding her head says it all for where all of us are at right now. We know vaccine confidence has been an issue. That goes without saying. I think it's now more of an issue that we're in the middle of this ongoing COVID-19 pandemic. And probably many of you have heard this term twindemic, right? We're all kind of bracing and figuring out what is this fall going to look like. We've got flu coming. We've already been dealing with COVID-19. So again, kind of pivoting back to communications, I think what we see here at the organization and what I even see on a personal basis is we are inundated every day with information. We are having our friends, our families, our neighbors, our healthcare professionals, our government. Everybody's trying to tell us what they think the right answer is. Everybody's an expert. And to be honest, it's really difficult for people to differentiate fact from fiction. They just don't know. So there's obviously the issue of misinformation and disinformation, but at the end of the day, we know people aren't really sure who or what to believe. And what's worrisome now is that this has potential repercussions for this COVID-19 vaccine as well. We know vaccine safety and efficacy are top of mind in terms of concerns for folks. So how do we address that? It's such an overwhelming problem. Where do we start? And so one thing that we did here at Families Fighting Flu, because we really wanted to do a pulse check on where people are at, is we did a national consumer survey in late May of this year, just to kind of get a pulse on where people are, at in terms of their feelings, their knowledge, their attitudes, their beliefs towards not only flu, but COVID-19 as well. So I'm going to talk about that in our next slide. So this just shares top line results. I apologize, there's a lot of information on here, and certainly if you want to deeper dive into it, happy to do that offline. But I just wanted to briefly touch upon where we're at. In terms of the survey, 43% of respondents got vaccinated last flu season. Some say they never do. We know that's the case. We know in this country our flu vaccination rates are not ideal. But the question becomes, who needs our attention? So again, perhaps not newsworthy, but this poll validated that underserved populations, Hispanics, African Americans, there are certain segments of the population that need our attention a little bit more. And the one concerning, well, there's a couple concerning things, but one concerning thing for me is that 35% of adults with children said that they don't get a flu vaccine. And that is, something that we've heard quite a bit, where people will say, well, I got my kids vaccinated. And then when you ask, mom, dad, significant other, parent, caregiver, whomever it may be, did you get vaccinated? And they'll say, well, no. And we have to really impress upon them the importance of community immunity, that when we get vaccinated against flu, it's not just about us as individuals, it's about helping also to protect our loved ones, the people that are around us. So the timing for flu vaccination, again, September, October into November, seems to be the theme. This year especially, because flu vaccination is more important than ever before, we really want to focus on extending the season. And what I mean by that is, for healthcare providers and patients alike, we want them to know flu vaccination doesn't stop at Thanksgiving. It's like, boom, done. No, we want people to know that even if they didn't get their flu vaccine, because we know life's busy, stuff falls off the radar, that flu vaccination even later in the season can be beneficial. So hopefully healthcare professionals, you folks out there, are reminding folks that, again, it takes 2 weeks to get that full immunity built up. So ideally, we want to get people vaccinated before flu starts circulating in their community. And I think the place of where people are getting vaccinated may look a little bit different too. When we polled people in this consumer survey about where they were getting vaccinated, it was primarily at a doctor's office or a drugstore, some places of employment. So again, this year that may or may not look different, and that's okay. We want to assure people that it's safe wherever they're going, regardless of whether it's the pharmacy, it's the healthcare provider office. We want people to understand that everyone is taking the necessary safety precautions to make it a safe immunization environment. So in terms of myths and facts, again, what rises to the tops is really vaccine safety and efficacy. People have questions and concerns about that. I'm not sure that's new, but that's something that we need to keep reiterating. Again, not just around flu, but an upcoming COVID-19 vaccine that will be important as well. And one of the other concerning things is, about a third of folks think they are personally not at risk for either COVID or flu. And I know we all like to think we're invincible, but that's just not the case. And so we see people kind of being complacent, if you will, because they think, well, I'm young, I'm healthy, I've never, had any issues, I've never had flu. And they think that they don't necessarily need to be vaccinated. So we need to work on that and get them again to understand that it is important. And we've probably all heard a lot of talk about overburdening or the potential overburdening of healthcare systems this fall. And I think one of the things we here at the organization we're focusing on is, how can we reiterate to folks the importance of not overburdening the healthcare systems this fall with COVID-19 going on. And that message didn't really resonate with folks. So again, I think we need to keep pivoting back to making it personal for them in terms of our communication. So the silver lining on all of this with the poll was that at the conclusion of the survey, at the beginning, 43% said they got a flu vaccine. At the conclusion of the survey, 53% said that they would perhaps get a flu vaccine. So just through that passive education and taking the survey, we saw a 10-point increase, which I'm going to take as optimistic and hopeful. So who do we need to really focus our attention on in terms of communication this fall? It's younger adults, it's those without a college degree in formal education, moms, Hispanics, African Americans. And again, we really need to educate around vaccine safety and effectiveness. And we have to communicate vaccination benefits, kind of put a positive spin on it. So we all probably have heard here or there the vaccination benefits that you can get. You won't get sick. I usually am not as blunt as say, hey, you won't be hospitalized or die, but that's a benefit too, right? We can keep doing the things that we love. So next slide, please. So these are three things that when I'm entering into a conversation with somebody about flu, it could be somebody in the supermarket line, it could be my neighbor, it could be a friend, it could be somebody through work where, I'm talking to a parent and having some dialogue on social media. I really kind of think about these three things in terms of a patient's perspective. The why. Why do I want them to care about flu? And this could be, any other vaccine preventable disease as well. Number two, what are the risks? What risks do I want to convey to them? And again, making sure that they understand that flu doesn't discriminate. All of us are at risk. And then third, and perhaps the most important, is how can I tell them or inform them or educate them how to protect themselves? It really comes down to an empowerment message. I share my son Joseph's story more times than I can count. And after I do so, I always say, you know what? It's just another piece of information. Not that I'm belittling my personal story, but my intention isn't that I want to force people to do something. I want them to take that piece of information, assimilate it with all the other information that they have, and then they feel empowered to make an informed decision about flu vaccination for themselves and their families. So if you click next, Cameron, it should fly in a couple answers. So number one, what's my answer to this? Flu is the deadliest vaccine preventable disease in the US until we have a COVID-19 vaccine, and then we can argue about who gets first place. Number two, again, just conveying everyone is at risk. It doesn't matter your gender, your race, your lifestyle, we're all at risk, and that is the reality of it. Obviously, there are high-risk groups for flu, but the reality is my son was healthy. A lot of the stories we have here at Families Fighting Flu, the individual was otherwise healthy. And then my answer to number 3 is, how do we empower them? Annual vaccination, flu vaccination is always number 1, but there's other things that go along with that. Practicing healthy habits. In this day and age, hopefully we're washing our hands, we're wearing our mask. And then if you do fall ill, because we know the flu vaccine isn't 100% effective, seek medical treatment if warranted. And if they prescribe antivirals and your doctor recommends that, or your healthcare professional, I should say, do whatever we can to, stay healthy and keep doing the things that we love. Next, please. So this is really our communication strategy at the organization, if you will. So I think the key here really is we need to reach people where they are. And what do I mean by that? Where are they spending their time? Where are they getting their health information? It could be social media. It could be their neighbor. We might not have control over their neighbor, but we can certainly engage with them on social media. Digital media, meaning websites, online information. Earned media, by that I mean traditional media, broadcast, print publications. That is an important way for us here at the organization every year to get these stories out, to get this information out. Already here we are relatively early in the flu season. I'm not sure we can say the flu season is officially kicked off yet, but already, which is optimistic, we have reporters and journalists who are reaching out to our organization and asking to interview folks so that they can kind of get ahead of the ball and, remind people again, flu is coming. It's not an if, it's a when. So what can we do to protect ourselves and our families? And then our stakeholder networks are very important. And that could be, our families, our board of directors, working with those folks who then can work at the community level to do that education and advocacy. And then strategic partners, that could be folks such healthcare providers such as yourselves, people in industry, academia, other nonprofits. Again, it takes all of us together. So what we need to really do in terms of communication is you need to identify who are your target demographics, right? Because it's not necessarily a one-size-fits-all message. So we have to think about who are we trying to reach and then where are they spending their time. Next, please. So I just put this slide up here specific to social media because it is a critical channel. And I will say, 4 years ago when I came on staff here at Families Fighting Flu, I didn't realize the value of social media, but now I realize this is where a lot of folks are getting their information, specifically health information. And as you can see the statistics there, which I took from Pew Research Center, this is kind of where it's at sometimes in terms of the dialogue and the ability for us to interact and dialogue. We also know that social media is, there's a lot of misinformation and disinformation on there. So it is a constant battle, but I think it's important, if possible, to have a presence on social media and especially different channels because different folks, again, are spending time on different channels. Next, please. So this is just really quickly highlights our social media demographics. I won't go through each of these specifically. You can look at the numbers in front of you on the slide, but we are active on Facebook, Twitter, Instagram, and LinkedIn. And again, the reason is because different people are spending time on different channels. So we look at that information. We certainly do cross-posting, which means, something you can put on Facebook can be used on Twitter, can be used on Instagram. But whenever possible, we always have to remember who are we talking to and what is the message we're trying to convey to them. In just last flu season alone, we were able to reach 5.7 million people through social media channels. So for us, it's a really big effort in terms of our time, our energy, and our resources, but we think it's a very worthwhile one as well. Next. So this is really kind of the meat and potatoes of what I'm going to share with you. And again, this is our communication best practices here at the organization. We realize as a nonprofit, we have a significant amount of leeway in what we say and how we say it. We realize that's not necessarily the case for some of you that may have some guardrails, shall we say. So for us, these are our best practices. If they work for you, great. But certainly if you've got a tried and true method, you know, this is for us, not necessarily meaning that it'll work for everyone. But using multiple channels, again, I just talked about that, connecting with people on different social channels, you know, having your website, hopefully if you have one, be as comprehensive as possible. We are constantly looking at our website and finding ways to improve it. Thinking of things like, oh, we don't have that on there, let's add it in. So that's something that is always very near and dear to us, and we put a lot of effort into it. And then again, traditional media. So reaching target audiences where they are, that really allows for engagement and dialogue. I'm not going to say that you're going to change everybody's mind, right? Because we know that in the spectrum of vaccine confidence, we have folks who are pro and we have folks that are anti, even though the antis are usually a smaller minority. We know that. So really where we're focusing our efforts are that middle section, that vaccine hesitant folks. And the important thing to remember is, you know, it can get frustrated for sure. I think for me, sometimes I take it a little personally, like, oh gosh, this person isn't understanding what we're trying to convey here. But you never know the effect you're having. So, you know, keep on doing what you're doing. The thing that I always try to remember is the silent observers. So if somebody has a question or concern, and maybe there is a negative connotation on it, on our social media channel, we may still answer that in a respectful manner, always. And it might not, our response may not necessarily be for the commenter. It may be for all those people that are seeing that. So those are the people we're calling those silent observers. So it's not, you know, you're just talking to one person. You're actually, your comment, your response is likely going to be seen by a lot of people. So that always makes me feel a little bit better because I may not have changed that one person's mind, but hopefully somebody else saw it and took it to heart. Be consistent in your messaging and your branding. This is important. This is something that we here at Families Fighting the Flu have been working on. We really want our branding to be consistent. We are a trusted resource, and we are very honored to be that trusted resource for people, and we want to continue being that. So we want to always, whenever possible, be consistent in our messaging and our branding. That being said, I know how hard it is to be creative and be, you know, it's like, get your flu shot, get your flu shot, get your flu shot. We have to be creative about that. So we always try to make sure that we're thinking about that. How do we keep being engaging and engaging these different audiences? Evidence-based information. I'm a scientist. This is an evidence-based organization. We will always revert back to the data and statistics and making sure that we're addressing health literacy levels. That's something else that we think is really important. We don't always do the best job, but we strive to. Know your audience, speak their language. Don't use a one-size-fits-all message. Always be respectful and compassionate. And that is super tough. I have been attacked personally and called all kinds of names, but I always keep it above board. Be respectful, be compassionate, walk away when you cannot be. Use a language that is simple and transparent, not too much jargon. And again, like I mentioned before, let's focus on flu vaccination benefits. Help protect yourself, your loved ones, your community. For those of you that are healthcare professionals, hopefully you're using a presumptive approach. You know, recommending flu vaccination, making every visit a vaccine visit. And this is important too, because it's something I've heard a lot. People will often say to me, well, I didn't get a flu shot because my doctor never mentioned it to me. So remember that the absence of a recommendation is still a recommendation for those of you that are healthcare professionals. And then share relatable personal stories. I'm going to touch upon that in a moment, but healthcare decisions are emotional for most people. Next.
Okay, so we're gonna do another poll question real fast. Let me get it open for you. So the question is, do you think personal stories are an important part of the narrative to encourage flu vaccination? I'll give everyone a few seconds to answer the poll. All right, I'm gonna close it in a few more seconds. Okay, thank you so much for taking that poll with us, and here are those results.
94%. Yay, I'm very happy to hear that because I know it's hard sometimes sharing personal stories when the story might not be yours. So thank you for that. So very briefly, why storytelling is important. I'm not a behavioral scientist. that I lead to the smarter folks, but we know that narrative communication is an important part, and that means using stories to convey the importance of, in this case, annual flu vaccination. So people learn different ways, but again, we have to make sure that we're tailoring our message and addressing those theories when it comes to communication. Next. So this is very interesting. It's a statistic about a statistic. I found it a couple years ago. It was actually coined by a psychologist by the name of Jerome Bruner, and it simply says stories are 22 times more memorable than statistics. We're human beings. We remember stories, not so much data and statistics, even though they are important. So just wanted to throw that up for you. Next. So very quickly, because I'm running out of time here, some of our communication don'ts: don't be judgmental. Not everybody knows what we know. I know more about flu than I ever wanted to know. I didn't know it before, and I'm the first to admit it. Avoid audience fatigue. Again, be creative. Put things in context. That's important too. And that's hard to do because you have all these nuggets of information that are going out, and it's really hard sometimes to put everything into context and bring it back. Again, don't be jargony. Try not to use overly technical language. Don't assume an authoritative position. Again, I always, at the end of the day, I don't want to tell you what to do. I'm going to recommend what you do, but I think that works well. And, don't use scare tactics or fear mongering. We here at the organization use our personal stories to illustrate the dangers of flu and the disease burden. Our presentation of those stories is so important. We never want them to be construed as us trying to make people fearful. We are sharing our stories in a compassionate, impactful way so that hopefully other folks don't have similar tragedies happen to them. And then align our messaging. I think that's something that's really key this fall. So much mixed messaging right now going on in light of the pandemic. So again, let's empower people with information. Next. So this picture here, I usually include this picture. Her name is Maddie Allen, and she is a flu survivor. But I always include her picture because I feel like if nothing else, I could put up her picture and say, this is what flu does, people. Again, not to scare people, but this is the reality of it. So again, these emotional stories move people. I will say, as many times as I've shared Joseph's story, and I have shared it what seems like a million times, I always have at least one person who comes up to me, and sometimes they whisper in my ear, I knew I needed to get a flu vaccine, but it wasn't until I heard your story today that I'm going to actually go do it. We know stories move people to action. So I can't say that strongly enough, but it has to be relatable to them. And that is the important thing. Next. So this is just a collage of some of our family stories. We have over 50 on our website right now. We don't just focus on children, even though I've lost a child, other families. We also have families who have lost husbands and aunts and uncles and grandparents. So again, it's across the lifespan, but our intention here, along with, the education that we do, we like to weave in the family stories, again, across the lifespan, to illustrate that this is a reality. People need to understand that flu, as much as we think a lot of us perhaps wish it were a bad cold, it's not. But these stories, again, can change vaccination behavior. Next. So the call to action today, let's all work together to avoid this dreaded twindemic. If you have community partners, some of you may be immunizers yourselves. Hopefully everybody's doing some clinics this year, addressing the safety measures again, which is a concern for folks. We have to make sure they're not complacent. They have to know they can leave their house, safely go get an annual flu vaccine. And for you healthcare professionals, please make sure every visit is a vaccine visit. And then if you would like to, just a little bit of information about our programs, we are doing a flu vaccination promise where we are real simple, just asking people to pledge to get a flu vaccine. You can use that link and just fill out a form, choose to have your name added to a promise wall. We also have a texting program, which you see on your screen there. If you want to sign up for that, you're more than welcome. And then we also have a flu champion program. So if you want to do some community efforts and we can help you, contact us. We would love to work with you. We do that with advocates across the country because we know those grassroots efforts are so important. Next. And then just really quickly, we have a ton of educational resources on the Families Fighting Flu website. You can order printed materials, you can download digital. We are here again to help you, so please take advantage of those materials if you so choose, which are available on our website. Next. And this is just my contact information. So please reach out to me, questions, any way you want us to support you, you want to work together. We really just want to work with others and help avoid this twindemic. And this year, flu vaccination is more important than ever. So I'd be happy to talk with you. And thank you for your time and attention.
Thank you very much, Serese, for a great presentation on the work of an amazing organization. And now I would like to invite Nisha and Anya to begin their presentation. Thanks again for being with us.
Thank you. That was a wonderful presentation. And I'm glad to hear Serese use the term twindemic throughout, because that is exactly what I wanted to talk a little bit about here. I'm just thinking about what we're anticipating for this flu season. Next slide, please. So as everyone knows, flu vaccination is recommended for all persons 6 months and older. We are really thinking about COVID-19 this year and the impact, and really thinking about those with overall respiratory illnesses who could really benefit from vaccination, as well as the vulnerable populations in our healthcare systems and other critical infrastructure. Every year it's important to get a flu vaccination, but this year it's even more important than it ever has been. And when we look at flu vaccination coverage for adults in California in particular, we're only at about 47.7% last year. The coverage rate is pretty low, and what we really hope for is to get even more folks vaccinated this fall. Next slide, please. So I just want to talk a little bit about high priority persons for influenza vaccines. We did say that the vaccine is recommended for everyone, but I think it's really important to think about certain populations, especially those that have been affected with COVID-19. So thinking about our essential workers, persons at higher risk for severe illness from COVID-19, those over the age of 65, residents in nursing homes, people with chronic medical conditions, and then those racial and ethnic groups disproportionately impacted by COVID-19. Also looking at persons at higher risk for influenza complications. So infants and young children, children with neurologic conditions, pregnant women, adults over 65, and people with chronic medical conditions. And as a reminder, we do want everyone to get protected against flu, but we're thinking about these other groups specifically when targeting efforts. Next slide, please. So how is the California Department of Health, Public Health supporting flu vaccination efforts this fall? We are expanding access. Every year, the health department purchases vaccine for local health departments who then go out and hold community-based clinics. This year, there's an additional volume of vaccine available that will be going to local health departments, to federally qualified health centers, to public hospitals and community clinics. We're also partnering with CPCA and CIC to support flu vaccination efforts, and I'll let Anya talk more about some of our campaign efforts. We're really prepared. We hope to prepare for increased patient demand using social media and outreach to create patient demand. And I will just mention briefly some of the plans. CDC is planning on an extensive influenza information campaign, and then we are planning targeted campaigns across the state. And I will turn it over to Anya, who will now talk specifically about, one poll question first, and then Anya can talk about some of the resources we have in place.
All right, so I'm going to go ahead and launch this poll. It's our last poll for the day, and it asks what your role is in fighting flu. Thank you, guys. We're getting some responses. I will give it another 10 seconds or so. All right, and we're going to go ahead and close that poll. We got about 80% response from the audience. And here is the results. Wow, very interesting. All right, and I will turn it over to Anya now.
All right, good afternoon, everyone. As Nisha mentioned, I'm going to talk a little bit about our flu campaign efforts this fall, but I first wanted to talk about some of our existing flu prevention resources, several of which have been updated recently to be relevant to the COVID pandemic. So you can see that there's the Stop Disease poster we have and flu prevention tips in many different languages, and I've included the links to those below. And then there's also the I Got My Flu Shot template that can be used to print stickers to place on badges for healthcare workers to promote flu vaccination. Also, there's the flyer on the far right that can be used to include information on where to get vaccinated and is targeted to workers in healthcare settings as well. And then at the link to the flyer at the bottom has helpful talking points for providers when talking to parents with concerns about flu vaccine. Next slide, please. I also want to talk to you a little bit about the shot-by-shot flu stories, a collaboration with CIC that we have. And as Serese had mentioned, sharing stories from people who have been affected by influenza is an impactful way to raise awareness and educate others on the risks of not vaccinating. And I've provided links to each of these different flu stories. Gianna's story and Scarlett's story are about young girls who were unvaccinated and tragically died from the flu. Gigi's flu story is about a school teacher who thought she was invincible to all the germs her students brought in the classroom. She never thought that she needed a flu shot until she caught the flu and she ended up in the hospital in a coma. Jojo's story is part of the American Lung Association's campaign for those 50 and older. Jojo talks about how the flu not only took a toll on her, but also she passed it to others in her family. Take time to share these shot-by-shot flu stories with others and promote the flu story infographics through your social media channels. And I've provided a link to the infographics there at the top. Next slide, please. As part of the Don't Wait, Vaccinate campaign, our campaign that we've started this year, we're working with CIC to develop various tools to promote flu vaccination, such as talking points, social media messages and images in English and Spanish, and more. We're also developing radio PSAs that will be launched in the next few weeks, and we're working to increase access to vaccination for vulnerable populations, such as farm workers, through a promotores network to ensure that they're vaccinated as well. See the link to CIC's Don't Wait, Vaccinate toolkit to view these campaign talking points, as well as download and share the various social media messages. We encourage you to modify them to meet the needs of your community. This year, we're also working to expand our partnerships to better reach those that are at higher risk of being exposed to or developing serious complications from flu and COVID, just as Nisha had mentioned, such as essential workers, like those working in long-term care facilities, pregnant women, Latin American and African American populations who are disproportionately impacted by chronic health conditions, and older adults. I'm going to go ahead and briefly share with you some of our talking points this season. One of our main messages is that getting a flu vaccine is more important than ever to protect yourself, your loved ones, and your community from flu. And we talk about this in the context of the COVID pandemic. So we point out flu can lower your body's defenses or weaken your immune system, making you more vulnerable to other infections, including COVID. We also talk about how flu and COVID share many symptoms, and preventing flu means that fewer people will need to seek medical care and testing for possible COVID or flu, reducing the burden on the healthcare system and saving limited resources for those that need care due to COVID. We also stress that while COVID and flu and COVID share many symptoms, for those that work outside of the home, essential workers, and others, they may need to miss days of work and need to get tested and stay home due to having flu or COVID. Here are some of our other social media images that we've created and that are on the CIC webpage that you can share with others. You can see that we're stressing one's responsibility to stop the spread of flu by getting their flu shot. And then similarly, as mentioned before, we're stronger when we're all protected against flu. Thank you. And on the right, we want to stress that while folks may feel a little bit uneasy about coming into the doctor's office, pharmacy, or flu clinic this year, there are additional safety measures that are being put in place to ensure that their patients are safe when vaccinated. So please check out these talking points and social media images and messages. Share them with your partners, patients, and others in your community through your social media posts, your press releases, your web pages, and other communication channels. And stay tuned for more resources throughout the season. And I've also provided some links to additional CDC, Immunization Action Coalition, and CDPH resources for you. Thank you so much.
I would like to thank all of our wonderful speakers today. Your passion, experience, and expertise are all so evident and will benefit us all in our efforts to fight flu. I also just want to quickly call your attention to the handouts that are available in the handout section on your screen. They're available there to open and download and print, but of course, be sure to take a look at some of the websites that have been suggested here today in our program. If our listeners have been waiting patiently to ask a question, now's the time. We just have a few minutes remaining. Please type your question in the question section at the bottom of your screen, or you can also place your question in the chat box. While we give everyone a moment to type in a question, I would like to remind you that following this program, an evaluation will pop up on your screen. We truly appreciate your responses. The California Immunization Coalition produces about 3 to 4 of these education hours per year, and we really rely on and value your feedback in preparing and improving these programs. So let's take a look and see what we have here in questions.
So Meg, we do have one question that came in at the beginning. And Natalie asked, can the flu vaccine be given at the same time as the shingles vaccine?
So that's a clinical question. Nisha, would you like to jump in on that?
Yeah. I will say that I am not a clinician, but I believe they does it.
All right, well, I am a clinician and bing, 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 that's correct. You can give both of those vaccines together.
Perfect.
All right, another question for Serese. Any specific tips on reaching the hard to reach populations such as the Hispanic population and African American population that you mentioned?
Yes, in short, I think number one, we have to make sure that those messages or deliverables are culturally sensitive. Again, people relate to what resonates with them. So there's certainly perhaps some specific concerns that those particular ethnicities may have. I know with African Americans, there's been some studies that indicate they are concerned about possible side effects with flu vaccinations. So, you know, there has to be a little research that's done. We frequently do literature reviews here to make sure that, you know, we're kind of honing in on that, but it has to be relatable. At the end of the day, that's kind of the short answer to the question.
Cameron, do you have any questions in your view? I do have one final question. Serese, I just wanted to comment that your organization is such a beautiful legacy for your son and for other families who have lost loved ones. Any comments on the personal strength it takes to share your story on a national level?
Yes. Gosh, I thank you for that, Meg. That's very generous and sweet of you to say that. And I'm going to try not to tear up, but yes, it's hard. It's hard to do this job every day. But here's what I think of my job, and I want you to all think about your job. Is every day what we do, we can save a life. And it's hard what we do every day. We're educating people, we're advocating, and some days, if you're like me, you come to your desk and you're like, oh, my tank is low. But what I think about is I have a chance to save somebody from having an empty chair at their dinner table. Every day I sit down for dinner, I have an empty chair at my table. But we all have the power to prevent that from happening to others. So that is the one thing I want to leave you with. We are all so important and we have that power in us.
Thank you so much, Serese. I think that's probably a good, I was going to ask you if you had any final thoughts as we wrap up, but that was just a beautiful wrap up. Any other final thoughts? All right, well, quickly, I just want to mention again that we are so grateful to Serese, Nisha, and Anya for their terrific presentations. We'd also like to thank members of the CIC Education Committee for supporting and planning these coordinating these calls. And a very big thanks to all of you out there in our audience for spending the hour today with us. Please remember to complete the evaluation form that will pop up automatically after this broadcast is complete, and tell us what you think of the webinar. And again, slides for the webinar will be available as well as past webinars at the CIC Coalition website. That address, if you're unfamiliar with it, is www.immunize.org. Oh, I'm sorry, immunizeca.org. Both of those are great websites. Look under the resources tab and then the education hour. Thank you again for joining us today. I believe we were able to get through all the questions, but please feel free to send questions to the CIC at any time. Thank you again for joining us and enjoy the rest of your day.
Bye. Thank you.
Bye.